Hey, this is Dr. Renicki with CellGen Regenerative Medicine in Savannah, Georgia. So I mentioned in a previous video that I wanted to discuss the two main types of stem cells that we can get out of the umbilical cord. So by the way, when a woman delivers a baby here in the United States, they're always going to ask her if she wants to bank her umbilical cord or if she wants to donate it. So banking it means that they're going to freeze it, cryogenically preserve it, so that if at some point in the future, either the baby or some other member of the family needs stem cells, then those are there kind of earmarked for them. Or instead, she can donate it. And that means now that the hospital will deliver those umbilical cords and the blood out of the umbilical cord to a laboratory that will harvest stem cells from it. So in the umbilical cord blood, there's a type of stem cell called hematopoietic. So hemato, like hematologist or hemostat, it means blood. And poietic, like potential. So these are stem cells that have the potential to become blood cells, red blood cells, white blood cells, and platelets. And these are good for helping with people who have things like rheumatoid arthritis or trying to help their immune system to rebuild and recover, let's say after chemotherapy or something like that. But these hematopoietic stem cells, they don't become new tissue cells. They don't become new cartilage or bone or skin or muscle or fat or those kinds of things. If what you're talking about is trying to regenerate tissue, again, whether that be bone or cartilage or ligament or muscle or tendon or skin or fat or nerve or organ, then for that, you want a type of stem cell called mesenchymal stem cells. So mesenchymal stem cells are the type that come out of the part of the umbilical cord called Wharton's jelly. So Wharton's jelly is kind of like the fatty layer that is surrounding the artery and the vein in the umbilical cord. And that Wharton's jelly is very, very rich with mesenchymal stem cells. And those are the ones that will ultimately become either bone or cartilage or muscle or tendon or ligament or fat or some sort of tissue like that. So one of the few things the FDA has had to say thus far about regenerative medicine is they want to make sure that tissue goes with tissue and blood goes with blood. In other words, if you're going to be injecting into the bloodstream, the FDA suggests that that should be umbilical cord blood stem cells, or in other words, those hematopoietic stem cells going into there. But if you're going to be injecting into tissue, like into the muscle or into the joint, then that instead should be the mesenchymal stem cells that are coming from the umbilical cord tissue, right? So that's a term they call homologous use. So homologous means the same use. So tissue into tissue, blood into blood. At CellGen Regenerative Medicine, we have both options available depending on what a particular patient needs and what their particular case entails. I will say that without a doubt, the mesenchymal stem cells are what we're using the majority of the time, because most of the people who are coming to us for degenerative joints. But certainly if we have a situation where the umbilical cord blood hematopoietic stem cells would be the appropriate approach, then those would be the ones that we would use instead. Hopefully that clears up a little bit more about the two main types of stem cells. If you are shopping one regenerative medicine practice, comparing it to another, make sure you're comparing apples to apples. If what you're interested in is help with a joint that's degenerated, you want to make sure that what they're using there at that particular practice is mesenchymal stem cells instead of the umbilical cord blood stem cells called hematopoietic stem cells. Typically less expensive to get the hematopoietic stem cells, but not the right tool for the job. So by all means, feel free to post any questions or comments that you might have about that below. I'll do my best to see what we can do to get back to you in a reasonable amount of time about that. And if you've got any health issues that you feel that regenerative medicine would be a good tool to look at, by all means, please contact our office and we'll let you know what opportunities we have for you to be evaluated. Thank you very much.